The warnings didn't appear overnight. They built over years in regulatory data, adverse event reports, and eventually public scrutiny. But the real question is, who knew? And what did they do with that information? The lawsuit. In May 2026, a class action complaint was filed in New York against Zoetis and its CEO, Kristin Peck. The lawsuit alleges that the company misled investors about the true growth potential of its companion animals segment, while failing to adequately disclose safety concerns and competitive pressures. It's important to be clear. These are allegations, not proven facts. The courts will ultimately decide their validity. Librela timeline. Librela, a monoclonal antibody therapy for osteoarthritis in dogs, received approval in Europe in 2020 and later in the United States in 2023. Following approval, adverse event reports began accumulating, as is typical with newly scaled treatments. In April 2024, a Wall Street Journal report brought increased attention to safety concerns surrounding veterinary arthritis drugs. Then, in December 2024, the FDA issued a formal warning letter to Zoetis related to promotional and safety communication concerns tied to Librela. After that point, scrutiny intensified from regulators, media, and investors and disclosure. During this same period, large institutional investors, including Vanguard, BlackRock, and State Street, maintained significant holdings in Zoetis. The lawsuit raises a key issue. Were investors given a complete and accurate picture of the risks, or were important signals like adverse event trends and regulatory concerns not fully reflected in disclosures? That's not something social media can answer. That's exactly what the legal process is for. Solensia, the quieter story. Solensia, the feline equivalent to Librela, operates on a similar mechanism, targeting nerve growth factor for pain management. But it has received far less public attention. One major challenge in assessing its safety profile is underreporting. In veterinary medicine, adverse event reporting is largely voluntary, and estimates suggest that only a fraction of events are ever formally recorded. That means absence of data does not equal absence of risk. It means uncertainty. The reality. This isn't just about one company, one drug, or one lawsuit. It highlights a broader issue: limited transparency in post-market veterinary drug surveillance, heavy reliance on voluntary reporting systems, and a gap between clinical trial environments and real-world outcomes. For investors, it's about disclosure. For regulators, it's about oversight. For pet owners, it's about trust, personal close. And then there's the part that doesn't show up in filings, charts, or earnings calls. The people, the ones who trusted the system to protect their animals. No lawsuit, no stock movement, no regulatory action can undo that loss. Thus, no matter where you stand, be it an investor, or veterinarian, or pet owner, ask better questions. Demand better data, because informed decisions depend on transparent information. And right now, that system is still evolving, and pets are still left dying, and their deaths are being underreported. And vets simply mark their deaths as being the result of old age. And it is this that will never show the real number of deaths to these drugs. Zoetis will continue to spew out lies about the safety of Librela and Solensia. And some vets intentionally miss the real reason behind the deaths of pets on Librela. And until the likes of the RCVS step in to police these false reports, it will never change. My darling best friend and family was killed by Librela, and the vet that lied claiming Librela has no side effects is responsible for his death. Shadow paid the ultimate price for her lies.